Good afternoon. Let's try that again. Good afternoon. We've thrown a lot of information at you. We realize that, and I'm certainly going to probably do my fair share of that, but I'll try to keep my comments brief and focused. And again, all of us have brought additional resources on all of these topics, and we certainly did as well at the SCAN Foundation. My name is Gretchen Alkema. I serve as Vice President of Policy and Communications for the SCAN Foundation. We're about 3 years old, so maybe some of you have heard of us, maybe not. We're down in Long Beach, and we were created by a one-time gift from the SCAN Health Plan, a nonprofit health plan here that serves California's older persons through Medicare Advantage and special needs plans. We do not have anything to do with plan operations or activities. We're sufficiently independent from the plan, but we definitely come from the same basis and fundamental mission where we look at how do we improve the care of older people by bridging medical and supportive services so that they may live well in the communities of their choice. And so what I'm going to talk to you today are about what are some of the things in the Affordable Care Act that drive towards that broad mission of improving not only care in the community, but the linkages between medical and supportive services. And certainly what we've heard already today is that, it's the issues of chronic conditions, but in addition to that, it's about functional impairment. It's about how people live every day that really has a substantial impact on the way in which people use healthcare services and then find themselves in precarious situations where individuals and families are wondering, what are the best choices for care? Is it staying at home? Is it in a nursing home, which is a place that generally individuals really don't want to be in their life. They'd like to seek care in the home and community, and that can be in a variety of different ways. So the Affordable Care Act has taken major steps toward that action. And why is this important? Well, we've got a pretty substantially aging population, not only here in California, but particularly nationwide. And not that aging is equivalent to the needs for supports and services in the community, but we know that as people grow older, the potential for them having chronic conditions and likely attendant functional impairment due to those chronic conditions definitely increases. California's population over 65 right now is about 11% of the state population at 4.4 million, and that's projected to increase to double, actually, I should say, at 2030, and so that the state's population will be 18% of the total population and about 8.5 million individuals over 65. That's a lot of older people, and we know that chronic conditions definitely increases with age. So a little pop quiz for you today. When we think about that group that's over 65, what percentage of that population will likely need some kind of long-term services and supports, daily help with bathing and dressing and transferring, certainly grocery shopping and meal preparation, managing their money, all those things that we take for granted on a daily basis that individuals will need some help with. Any guesses from the audience of what percentage of anybody over the age of 65 from that point in time until they move on from this earth will need at least some long-term services and supports? Any guesses? D is correct, 70%. So when you think about that number, it's pretty substantial. And the average period of time in which an individual will need some form of long-term services and supports is 3 years. So sometimes it's only a couple days and weeks. Sometimes it's obviously a much longer period of time, but an average of 3 years. So this is a pretty substantial part of the way in which we think about our lives as we grow older, and there are definitely ways that we can manage that point in time in our life and have it be more person-centered and driven by our needs, wishes, and choices. And I can tell you right now that California voters are just not prepared for this point in time. We did a survey with the UCLA Center for Health Policy Research last year, and we'll be repeating that survey here in the next few weeks. And what we found was this was a public survey done by Lake Research Partners and American Viewpoint, who found that 58% of the California voters aged 40 and up feel unprepared to pay for services and supports. Most don't have the resources to pay for more than 3 months of home care, certainly not of nursing home care, and only 20% of those surveyed know that Medicare does not pay for these services. There were a lot of I don't knows in that question set, wondering, does Medicare pay for long-term services and supports? And the answer is no. These were majority responses across political parties. So the issue here, the challenge here of supporting people as they grow older with needs is not a partisan issue. Sometimes the solutions can get into that bailiwick, but ultimately what the base issue is that this is an issue for any member of Congress, certainly any member here in Sacramento, especially those who have substantial aging populations within their districts. So let's talk about a couple of the provisions that are in the Affordable Care Act that really seek to transform the long-term services and supports picture. And one I'm going to focus on because it's new and certainly has a lot of development that it's in process right now, and that's the Community Living Assistance Services and Supports Act. And this creates a voluntary, publicly administered long-term services and supports plan so that individuals can purchase into it, working individuals. So all of us today, because I'm sure that all of you aren't just here on your free time, working individuals can purchase into this long-term care plan and be able to, after a 5-year vesting period, be able to draw down a cash benefit at the point in time which you may have functional needs or limitations. 2 or more activities of daily living impairments would be able to draw down a cash plan that would be an average of $50 a day. What this provision in the law does is creates an opportunity for people to actually invest in their future and take personal responsibility for what we see as a growing need of individuals who will need services and supports as they grow older. And so right now, private long-term care insurance market only saturates about 10% of the market, and one of the reasons is because it does not have guarantee issue and because it's pretty costly for individuals to purchase. This is a guarantee issue product, and it's in full development right now at the federal government. And so you'll hear some more information coming forth about class, certainly in the coming months and years. It's slated to be operational by October of 2012, and where individuals, working individuals of today will be able to purchase into that program. There are a number of mechanisms to expand supportive services to help individuals remain in the community through the Medicaid program, or Medi-Cal as we call it here in California. Things such as the Community First Choice option, which would provide more supports for people to get personal care and attendant services in their homes and communities. There's also a variety of much more wonky options, ways in which the state can apply for waivers and ways of using the Medi-Cal dollars to be able to help people be able to stay in their homes and communities and not find their way into nursing homes. Ultimately, that's the choice that people have, and that there's ways in which of using the limited state resources that we have to provide much better access to people based on their individual desires and needs. One critical feature of the Affordable Care Act is about how do we coordinate care across the medical and supportive service divide, and there's been a lot of discussion about what's a term called care transitions, that point in time where people are leaving the hospital and they're trying to get their way back home, and sometimes that can be just a gulf for people, and they don't know what their medications are, they don't know, the home health provider doesn't come with the oxygen or the hospital bed. There's a lot of challenges when people are trying to leave the hospital and get back home that end up with people returning back to the hospital, and that's a very expensive revolving door that people find themselves in, as well as incredibly disconcerting for individuals and families. And so there's resources in the law to improve care transitions programs, to engage both hospitals and community providers, and the Secretary of Health and Human Services at the federal level just recently announced on Tuesday that they will be putting out $500 million in grants to communities that will be applying for care transitions money. California has also taken steps to draw down some of those options as well in an earlier release last September about improving options counseling for older people and people with disabilities, about what are care options to be able to remain in the community, and to do more test piloting of care transitions work. One of those communities in particular was San Diego, who received some of those dollars here in the state. An exciting development that happened actually it was just announced publicly by the federal government today is that there were 15 states that had applied for planning money to be able to improve care for those individuals who receive both Medicare and Medi-Cal dollars and services. We often call them dual eligibles here in the state. And California was one of those states that received $1 million in planning money to be able to look at how do they improve care across those two very complex payer services and be able to make it so that what are often some of the most vulnerable and health-challenged individuals in the healthcare system have a much more seamless experience in their care and don't find themselves kind of bouncing in and out of hospitals and home health care and nursing home care, but can find their way to remain in the community. There are a number of workforce enhancements, which I'm not going to go through because our next presenter is going to talk about that. And there are also a number of nursing home reforms in the law as well about improving the training and the information about the direct care workers who serve in nursing homes, as well as increasing the transparency of ownership and quality in nursing homes. And so, again, this is a huge section of the law that's interspersed throughout many of the different titles, but it has a real resonance to individuals, whether they're receiving services from publicly funded sources such as Medicaid, or individuals who want to do pre-planning for their own long-term services and supports needs through the CLASS program. And so for more information, what it's in your packet is a one-pager that is two-sided, that what we call kind of our top 10 selected health reform resources list, and it has not only a policy brief that speaks about all the provisions in the law that we particularly focus on the continuum of care, but an update on where those provisions are at year one of the Affordable Care Act, as well as a number of different briefs on specific provisions in the law about long-term services and supports and the continuum of care. And I'd be happy to take any questions that you have after the next speaker. Thank you.